In this video, we're going to discuss how to brace your core properly with a neutral spine. Too often, I see people trying to brace their spine by pelvic tilting and really flexing their spine when they haven't mastered how to stabilize their spine in a neutral position. So this is how we're going to begin doing that, and then this will be the foundation for all the other movements that I'll be able to teach you. So here, what we'll do is, put your hand on either side of your pelvis there, okay? And so what I want you to do, your knees are going to be in line with your hips, and keep your head back down. So what you want is your back muscles to touch the floor, but you don't want to be pushing your spine into the floor. Too often people really smash their back into the floor to get themselves to stabilize. So I want you to just tilt your, just slightly, yep, perfect, a little bit less than that, right there, okay. So it's going to feel like a very awkward place because you're going to feel very weak and vulnerable there, like you're not going to be able to maintain that, but that's important, and you have to honor that experience so that you can learn to stabilize there and strengthen yourself in that position. So you don't want to be pushing your back into the floor, but you want your muscles to be touching. So for many of you, you will naturally just be there as soon as you lay down. And for somebody who has a little bit of an exaggerated curve to the lower back, you'll just have to make sure that just slightly you're tilting your hips back a little bit. Okay, so while maintaining that, I want you to think about your ribs here as kind of being almost disconnected. They're like lifted up, right? Mm-hmm. So you're going to blow out and try to pull your ribs down without moving your back. Perfect. Okay, so now these ribs are nice and flat here. There's a nice connection. And so what will happen when people initially start to do this is that when they pull the ribs down, they'll flatten the lower back even more. So you want to be aware of that. Be careful not to do that. So while maintaining this, I want you to blow out a little bit more and pull your belly button away from my hand. You're going to sandwich it right into your spine. Perfect. So slightly, you probably can't even see it on the video. Her lower belly, her lower abdomen just flattened right down like a pancake, okay? And so that's what you want to maintain. When you're doing this, you'll feel this band of engagement here right below your belly button, and that's what we're looking for. That's the experience you want to strengthen and maintain throughout your movement. So when you're not feeling this and you've lost that experience, you're likely doing something incorrectly. So, okay, so now what we're going to do to strengthen that, you're okay? Mm-hmm. Hands, palms facing each other. Now very slowly you're going to lower one arm down and try to touch your thumb to the floor, and then come back up. Okay, so just relax for a second. We'll reset your brace. Okay, so blow out, and you're going to pull down and in. Perfect. Excellent. Okay, so now as you lower that arm down very slowly, you're going to feel a pull start to happen, and you want to resist that by tightening this. Excellent. And come back up. And now let's go the other side. Perfect. Your speed is good, nice and slow. Yep, and you want to resist that. Excellent, excellent, excellent. Good. And come back up. So for many of you, this is a perfect place to begin, because even being able to breathe and have your diaphragm move up and down will challenge your ability to hold this brace in, to continue drawing that belly button in while your spine is in a neutral position, okay? And so you can relax there. So if this is challenging for you, meaning as your hand starts to get close to your head, that you feel either your back lifting or you're not able to keep that belly button sandwiched in, that band underneath your belly button engaged, then this is where you want to work. And it doesn't matter if you can only get your arm halfway down at first. You want to honor that. And so you're going to be moving through the position as perfectly as possible. And you feel like if you're gonna lose control of that, you're gonna come back and return to the start position. And as you practice that, you will get stronger. The more you do it incorrectly, you're just reinforcing bad habits. So how do you progress from this now? This gets easier. You're doing, say, you're alternating sides. You can do 10 to 20 on each side, no problem, without stopping to reset the brace in between. Then we're going to move on to some hip motion. So the first step for the hip motion is that you're going to keep your hands here because you want to make sure that you experience the side that you're moving. The hand will drop down if you're not braced enough, okay? So what we're going to do first is you're going to set your brace, and then kind of take a pause and breathe out again to really engage it. And then you're going to try to move the leg, we'll go out halfway and come back, okay? And so I want you to think about, because what happens most times, people overuse their quad, and their hip flexors to help them stabilize. So you want to almost just think about your legs dead weight, okay? So I want you to set that brace, so blow out and in. Just make sure, pull your belly button in. Yes, perfect, okay. And so now try to move that foot, blow out again without, don't lose this, pull this in as you pull it in, pull it in, pull it in, yep. Good, and come back. Good. Did you feel that through here? Perfect. Okay, so let's try the other side. You might want to reset. Yeah. Good. Good. Yeah, see how this side's a little trickier actually? Okay, come back in. So, you reset your brace for me? Yep. Don't overdo your back. Good. Down and in. Perfect. Okay. Blow out again. Really lock this down. Don't let that hip move. Okay, go with that left leg. Pull it in, 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 pull it in. Excellent, excellent, excellent. Good, and come back. See the difference? You have to really fight for it. Okay, so that's the next step. And you really want to spend a lot of time practicing this one, because if you can't do this well, we can't advance you through the other movements. So when you're doing this movement with just trying to extend the leg out slightly and come back without your pelvis dropping down, that you're controlling your pelvis. Basically what you're trying to do is with this brace, you're stabilizing your pelvis and your lower back. And then you're moving your hip and you're disassociating that motion so that you're allowing your hip to move while you're training your body to stabilize your pelvis and your lower back at the same time. And that is key. So this will take a while to work on if you're very weak, but the better you are at it, the slower that you can move, the further your leg can go out and you can stabilize perfectly, you'll be so much better off and you'll advance through your other movements much faster. So you really want to take your time with this one, making sure that before you move the leg, that you're really engaging that belly button and pulling it in. And you could see as I was instructing Erin that as she was moving the left leg, you'll find one side is going to be more difficult than the other. As she was going to move the left leg, she was having a really hard time drawing that belly button in, and what people will often do is actually start to push out, to create some abdominal pressure to give them a sense that they're stabilizing. So you want to be very careful not to do that. So you want to make sure that if it feels challenging, really honor that and really keep really trying to draw that belly button in hard, and almost like your effort should be so great that you could break a sweat, you're trying so hard. And so thinking about the leg, the quad being almost dead weight, it will engage, but thinking about it being dead weight is helpful so that you can focus your attention to drawing that belly button in and stabilizing right below that, right along that belt line.